People sometimes tend to forget that children are also affected by cancers. We tend to be, drawn into talks about cancer, breast cancer, colon cancer, but children are also not exempted from having this disease. In children, leukemias form the most common type of cancer. They account for about 30% of all the cancers that we see in children. And 85%, or at least 85 to 95% of leukemias in children are acute leukemias. As we know, leukemia occurs as a result of a clonal expansion of cells during the process of maturation into the normal cells. Our cells, our blood cells, they arrive from what we call a pluripotent hemopoietic cell, which is a cell which is capable of dividing depending on what is the need of the body. So somewhere during the process of this division and maturation, there is that occurs an arrest, and that clone will start to expand and occupies the whole of the medullary cavity or the bone marrow cavity, resulting in the symptoms of leukemia. So looking back at acute leukemias, there are two types: acute lymphoblastic, or what we call ALL, that counts for 75% of the acute leukemias, and the other 20% is acute myeloid leukemia, which is the not so common form. The chronic leukemias, which is usually seen in adults, such as the chronic myeloid leukemias, accounts for maybe 3 to 5% of the cancers that we see in children. Maybe in one practice, an oncologist may see one case a year. Chronic lymphocytic leukemia, which is essentially an adult disease, is hardly ever seen in children. But there is another type of leukemia called the juvenile chronic myeloid leukemia. This is a very rare type of leukemia occurring in children usually under the age of 2 years. It's quite separate from the chronic myeloid leukemia, and the treatment is also quite different.